Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain-Free with Dr. Marc Darrow from the Joint Rehab and Sports Medical Center in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified through his studies at UCLA, and Dr. Darrow uses stem cell and platelet-rich plasma therapy to heal your body. He teaches about the use of stem cells, PRP, and prolotherapy. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Nita Valens.
Hi there, Dr. Darrow.
Nita Valens, you look gorgeous as usual.
Oh, you're hilarious. Hilarious.
Aren't I?
You're very funny.
Everybody tells me that.
So let me tell you what's going to happen today. We're going to help a lot of people.
Let's go for it. All right, I like that.
So the first thing you need to know is to get Dr. Darrow's latest book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. You need to call us right here, right now. At what number?
The number. What do you mean? We all know the number, don't we, by now? It's 866-870-5752. 866-870-5752. You can learn how to heal your musculoskeletal orthopedic pain without surgery in most cases. I'm going to repeat it now that I've piqued your interest. 866-870-5752. If you want to call the office now or later, there are people always there by the phones. That's 800-300-9300. The office is 800-300-9300. And if you want to email me, go to my website, www.jointrehab.com. Every page has an email slot, and I answer every email every single day. What else, Nita? Free book. Let's not forget that.
That's right.
This book that I wrote, which has a couple hundred pages of information of how to heal yourself by using stem cells or PRP, platelet-rich plasma, or prolotherapy, which is, to me, it's the weakest of all the healing forms with injections, but it's still pretty good. And if you like that, then we'll get into that more later in the show. But I've had that done on me. I've had PRP done on me. I've had stem cells done on me. And the done on me is usually me doing it to myself. Because I trust my own injections. And I've done very well. I've been self-injecting for over 25 years, starting at my residency program at UCLA. UCLA. Don't feel bad. I also went to USC. I've been to a lot of colleges. I'm a crazy student guy. I spent 22 years in college with different degrees, Masters of Taxation, fellowship in functional and alternative medicine after I finished my residency. So I've studied traditional medicine. I've studied outside-the-box medicine that a lot of people call alternative medicine. To me, it's not alternative because if it's natural, it's always a good thing to try first. You always want to do the conservative things in medicine before you get into invasive things like surgery or medicine. So, Nita, I'm going to throw out a quick joke for you.
Oh, boy, I can't wait.
Yeah. I'm trying to remember who gave the two jokes. Who was this that gave this to me? I think it was a patient. No, it wasn't. It was a minister. That's right. A couple of days ago, I talked to a minister friend of mine. So, you ready, Nita? Put on your thinking cap.
Okay.
How do you pick up an elephant with one hand?
You didn't let me say anything yet. I have an answer.
Okay, go for it.
You grab his trunk.
I don't know. You don't have to worry about finding an elephant with one hand. They don't have any hands.
So what's the real answer?
That's it. You don't have to worry about finding an elephant with one hand.
Oh, okay.
That's the answer? This is a better one. This will be easy for you. Ready?
Right. Oh, yeah, I'm sure.
You know what? I keep telling stupid jokes until people call in the show.
Oh, please call. Maybe we should give the phone number again.
Yeah, I'm going to. The call-in number is 866-870-5752. We love talking to you. You can ask questions about your family, your friends. about your own pain in your body. You can make up a fake name if you're shy. We don't care. We're going to treat you good and love you. Okay, Nita, you ready?
Yes.
Why did the Invisible Man turn down a job? He couldn't see himself doing the work.
Oh.
Cute, huh?
Very cute. I like that one. That's funny.
It is cute, yeah. Didn't hurt anybody's feelings.
You know, there was a TV show called The Invisible Man before
I remember.
my time.
Oh, my God. It was in my time. I was a little guy, but I still remember it. So I'm going to go to some questions now.
Okay. Do you want to give the phone number again?
Sure I do. I'm going to give a couple phone numbers. One is to the studio where you can talk to me right now live. That's fun. And that's 866-870-5752. Or you can call the office if you're too shy to call the radio. There's people there. 800-300-9300. Or go to the website if you're really shy. and you can ask questions there by way of an email directly to me from the website. And the website is www.jointrehab.com. All right, so this says golfer's elbow and tricep tendonitis. We get a lot of this. I get a lot of golfers, and as a matter of fact, if you're looking at the video of this show sometime, you'll see I've got my golfer's hat on and I'm ready to go after the show today. I'm going to meditate for an hour, and then I'm going to go hit the golf course. Hit it with a golf club, that is. So this says, hi, I'm interested in elbow therapy for golfer's elbow and triceps tendonitis. Can you please advise the next steps? Well, there's a lot of steps to healing anything, and you want to go conservative, obviously, first. So if this is something that's new to you, you may want to just let it subside and see if it heals on its own. Most things people have heal on their own, which is great. You can try acupuncture, physical therapy, massage. There's all kinds of things. I'm not a fan of anti-inflammatory medicines like ibuprofen because they actually block healing. They make you feel good because they get rid of the pain right away. But they block the fibroblast infiltration that the body naturally produces to grow new tissue back. So if you sprain an ankle, let's say, and it's black and blue, that's a good thing. That means there's a little bit of bleeding, and the inflammation sequesters or draws fibroblasts from the blood to come to that area. And fibroblasts spit out collagen. Collagen is the major constituent in our tendons and ligaments and in the joints, the cartilage. So that's a good thing. When people go, I can't stand this inflammation I have, I'm going to take an anti-inflammatory or get a steroid like a cortisone shot, they're really making a mistake in my book, because what they're doing is they are winning the battle. They feel better, but they're losing the war. The war is healing. We want a complete healing. So what do I do for these type of syndromes? I'm going to inject probably on something simple like a golfer's elbow or triceps tendonitis, some platelets from your blood. We just draw the blood, we spin it in a centrifuge, we throw away the red cells, we keep the platelets in the plasma, which is why it's called platelet-rich plasma. And simple little injection, 30-gauge needle. It's like an acupuncture needle. And I weave back like a new web of tissue, stimulating new tissue to grow. Golfer's elbow is on the lateral epicondyle. So it's called lateral epicondylitis, and that's considered golfer's elbow because average golfers like me flip the club at impact with the ball. Instead of, it's hard to explain this unless you're a golfer, but I know a lot of golfers are listening. Unless you rotate your hips and keep your left wrist in a flexed position so you don't flip it. And if you do flip it, like most of us do, you're going to activate that extensor tendon on the lateral epicondyle and stress it out and cause golfer's elbow. If you're a tennis player, you get medial epicondylitis. Sometimes golfers get it too. And that is just as painful, but it's on the medial or middle part of the elbow. Same type of a syndrome, though. Triceps tendonitis, the tricep muscles on the back of the arm. It inserts on the elbow. And triceps tendonitis can be very painful. It occurs most commonly that I see with weightlifters when they're doing tricep curls, or extensions, I should say. And that can micro tear that tendon attachment to the bone. Very simple to heal, just like golfer's elbow and tennis elbow. Okay? So all these little syndromes are usually really easy to fix with PRP, platelet-rich plasma. If it's more resistant to healing, we may add some stem cells to it. That's another very simple procedure. I have Dr. Grove, Thomas Grove, who's in the office with me now, and he saw me do a bone marrow the other day, bone marrow aspiration for stem cells, and he was scratching his head. It was like, how do you do that so quickly? He said he's been all over the country watching doctors do this, and I'm the fastest he's ever seen, and the patient had zero pain. That's because I've done so many thousands of them over the years that I'm very adept in knowing how to do it very simply. And for bone marrow aspiration, very simple. The patient lays down. We numb up the what's called the PSIS, the posterior superior iliac spine. It's the top of the back of the pelvis. Numb it up, and a little lidocaine, and we wait. I tell a couple of jokes usually, because when I ask patients to tell jokes, they're like, I can't remember any. So I always know lots of jokes. I tell a couple of jokes. By then it's numbed up, and then I take a very small needle, and we have a little teeny drill, and we drill into the bone there. And getting into the bone for an average person takes about 3 seconds. And then we put a syringe on the back of that needle after it's placed properly, and we aspirate out bone marrow. And for something like if we were to do a golfer's elbow or triceps tendonitis, we'd only need to take out maybe 10 cc's, very small amount of bone marrow. And the bone marrow is very rich in stem cells and platelets and cytokines and growth factors. So from my knowledge, it's the best healing we have today. There's other forms of stem cells that are done. There's lots of new things coming out. And when I find something better than what I know, I'm going to learn it right away and try it out on myself and see if it works. So the phone number to talk to me live right now is 866-870-5752. I'm going to repeat it. Grab your pen. Call me. I'd love to talk to you about your orthopedic issues or about your friends, family, whatever. And if you're shy, use a fake name. We don't care. The number to the studio right now, live, and as Dr. Jean would say, live and local. By the way, Nita, I called him up, and I don't know if he's still around. I left a message and did not get a phone call. He's got to be in his 80s now, living down in Arizona, I think. But he was a great host.
He was.
Obviously not as good as you, Nita, but he was great.
He's a man. What can you say?
That's right. And he was not gender fluid.
Well, he was a great guy, and he was a pharmacist, actually.
He was. Dr. Gene Steiner, a great, great man. I hope he's still alive, living a very full and happy life. And Dr. Gene, I do love you still. Please call me back. So that's the phone number to the studio. Once more, 866-870-5752. We're waiting for our calls. In the meantime, you can call my office at 800-300-9300. Or you can go to the website. There's endless pages on different musculoskeletal syndromes. You can learn an awful lot. The anatomy is there. How we fix it is there. And most importantly, there's videos of me doing these procedures you can watch and see if it's something that you would like to do if you're in pain. Certainly consider doing regenerative medicine. Regenerative medicine means that we inject the area, the tissue grows back, and you are healed. So in my book, do that first before you do a surgery, unless it's an emergency surgery you need. And I had a father call in yesterday about his D1 basketball player son who had dislocated his shoulder over the years many times and just had a recent injury a week ago and wanted the son to come into me rather than getting an immediate surgery. But a piece of the humerus bone, which goes into the shoulder joint, the glenohumeral joint, had actually chipped off. And I said, you need to see a surgeon first. He had had good success with me before, just using injections. But this is something that, to me, is an emergency. You've got to see a surgeon for something like that. After the surgeon says, I don't want to work on it, you don't need it, then they can come to me, and then I'll do my work and typically get the area healed. But there are many times when I want a surgical consult. If I think it's a dangerous type of situation, I don't want to step in at that point. I want the surgical consult first. Not often that I get that, but it's often enough that I have friends who are orthopedic surgeons who I have their cell numbers, and we call them up and find out what's going on. Need anything to say? Yes, you do.
Yes,
we
I do.
also do the vampire facelift in the office, where we take stem cells or platelets and numb up the face and put those into the face and regrow the collagen, make you look young again. And we also can regrow hair if it's thinning out, and we just inject that on the top of the head. We numb up the scalp and then inject that.
How about that free book?
Yes, you get a copy of my book, Stem Cell and Platelet Therapy, if you call in the show right now, and that's a $25 book. And I even pay the postage, which is usually about $7 or $8. So free book, and you can get a copy for your doctor also and teach him how to heal in a natural way rather than offering surgery. Most doctors out there, even if they're not surgeons, don't know about regenerative medicine, or they don't believe in it, and they will immediately send their patients to the surgeon, the orthopedic surgeon, which is fine, but don't get a surgery when you do not need it. And I run into this almost every day with people that have failed surgeries, failed back surgeries, neck surgeries, shoulder, knees, hip surgeries, you name it. And why do they fail? Because the surgery should not have been done in the first place. Probably should have been done regenerative medicine-wise. Heal the area conservatively with simple injections of platelets or stem cells. Very easy thing to do when you know how to do it. I use an ultrasound which looks into the body to help me guide the needle. If you are getting injections with regenerative medicine without an ultrasound, that's a faux pas in some areas, meaning don't do it, because the doctor doesn't know where that needle is going. There is a doctor in Santa Monica who gets a lot of business, and when people say use an ultrasound, he goes, I don't use an ultrasound because I know the anatomy. Knowing the anatomy is not enough. If you want to place a needle 4 inches deep into a hip joint, you don't know how to do that without an ultrasound. You can pretend, but you're going to not hit the right spot. The shoulder joint is the same thing. It's a millimeter big. You cannot guess and get it into the right spot. Hip joint, knees, same thing. You don't know if it's going there. The studies show that blind injections miss the spot 1/3 of the time. And for those of you that have gotten hyaluronic acid injections, lubricant, and your knee has blown up like a balloon, that's because the solution did not go into the joint. It went into the soft tissue, and sometimes that requires an I&D, an incision and drainage. You have to go to the OR and clean the stuff out of there because it didn't go into the right spot. Use doctors that use ultrasounds for injections, please. Nita, I hear you breathing,
Yes,
so you must
we
have
have a
something to tell
caller
me.
from Alabama. How about going to Tila?
Tila, Dr. Marc Darrow, how are you today? Your hand is bothering you.
Stunningly well in God's economy. How are you doing, my brother?
I am living it up, sister.
I know you are. I listen to you pretty much weekly, and I know
good.
you are. I've got a lot of people listening to you and going to your website, and you've sent books, and I've got a book, and so I don't need a book today, but and I've got some people I'm hoping are going to call in soon and dialogue with you, because I think they'll be fascinated when they get into a conversation with you, and you know what you're talking about, but I think most of them are talking to doctors who don't know what you know. So, but the question I have is for myself, and I hope it will benefit other people who might have the same issue, is the hands.
Okay.
I'm not sure that I hear much about the hands, and I really tore mine up a few years ago doing really excessive work with them, and they're not going to recover easily. And I've been doing I had the trigger finger thing years ago in 2005, did a surgery, not realizing I could do an injection, did an injection from there on all my fingers. They all have locked. But now the injections are not working.
Okay.
And I'm doing PT, faithfully doing my exercises, not working.
Okay.
The fingers aren't just locking, they just won't even bend sometimes. They are locking, but that's not the only problem.
Okay.
So I'm trying to find out if you do that type of the PRP with the hands.
It can be done. It's not. Trigger fingers are not my major work. Okay. My major work is growing back tissue after injuries or arthritis anywhere in the body. The hands also. I do a lot of hands, but not generally trigger fingers, and I'm going to explain why. I do know doctors who inject PRP for trigger fingers, and I'm willing to do that with you. It's not my expertise, though. I'm going to tell you that. So we would be experimenting together, and I'd be happy to do that. I would use an ultrasound so I can see where that little needle is going. And probably when you had those injections, your doctor did not use an ultrasound, because most hand surgeons do not, if it was a hand surgeon, don't know how to use an ultrasound. It was.
Yeah.
I'm sorry?
Yeah, it was a hand surgeon. He did not use ultrasound. Any of them I've had several doctors over the years, because I float states, so I'm not always in the same state.
Yeah.
But none of them have ever used an ultrasound. And the problem is that they're not only locking. I don't have just locking fingers. I have some that aren't locking but won't bend all the way anymore.
Okay, I heard you. Let me do a little dissertation for you. Let me talk for a while, because I have a lot of information for you. Number one, trigger fingers generally start with a catching of a tendon, a flexor tendon in the hand that comes down from the forearm. And the tendons are like strings. The muscle contracts, it pulls on the tendon like a string, and then it attaches to the different joints in the fingers and makes them flex. Also on the back of the hand, there's muscles that will extend the fingers. But on the flexor tendons, there are what we call pulleys. There are little pieces of collagen that go across the tendon and hold them down into place so they don't bend, so they don't straighten out into the hand. Okay, so they hold them down to the tissue. Those tendons can be fibrotic, where they cross the A1 pulley or the A2 or A3 pulleys. And you can look this stuff up on Google if you haven't seen the anatomy. Just go to Google and put in trigger finger and put in A1 pulley, for example. And then on the upper left-hand corner, when that comes up, look at images and you can actually see this stuff. So what you had done was you had a trigger finger release where they cut the A1 pulley. How many trigger finger releases surgically did you have done?
I've had one trigger finger release by surgery, and then the rest by injection in all fingers.
Okay. And the one that you had surgical, did that work really well?
It did at the time.
And then it came back?
Yes, sir, over time.
Okay. And then, if I got my history correct from what you're telling me, then you had injections of something like cortisone, a steroid. And the reason for that is it disinflames and shrinks down that A1 pulley. Okay? Mm-hmm. So then the tendon can slide again. The problem with that is it's a great treatment one time if you leave your hands alone. But if you're active, then that inflammatory response will stop, and then you'll recreate the same situation. And if you repeat the cortisone or steroid injections onto that pulley, you can rip your tendons. And then you have a major problem, because cortisone dissolves tissue. And people, when they come in the office and they've had a bunch of cortisone, the first thing I say is, please don't ever do cortisone again. And they go, why? My doctors are doing it. I had one lady had it done 16 times in her elbow, and she couldn't lift up her hand because the tendons were torn. Hang with us. I'm going to go to the break here, and then we'll get back to you. The phone number to the studio is 866-870-5752. If you call me now, I'm going to send out a copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. Give me a call at the studio right now, 866-870-5752. We'll be right back.
Yes, we will. I'm your host, Nita Fallon. Stay right with us.
You're listening to Living Pain-Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.